How to use aspirin during a heart attack. One ordinary morning, you wake up, brew a cup of coffee, and prepare breakfast just like any other day. Everything seems calm until you suddenly feel a crushing pain in your chest, as if someone is squeezing your heart with both hands. Cold sweat begins to pour down, your breathing becomes rapid. Panic sets in, your heartbeat races, and in that moment, you have only 5 short minutes to fight for your life. What would you do? What few people know is that in those critical minutes, a tiny pill, aspirin, can be the thin line between death and survival. If chewed at the right time, aspirin can buy precious minutes for your heart until emergency care arrives. But here lies the paradox. Aspirin can save your life, yet it can also take it, if used the wrong way. Why is that? In the United States, thousands of heart attacks occur every single day, most striking suddenly while people are doing the most ordinary things. And yet, many die simply because they never knew that the familiar little pill sitting in their home medicine cabinet could have changed everything. Do you see the irony? A drug so cheap, so easy to find, and yet so rarely mentioned as the hidden lifesaver. So what exactly does aspirin do inside our body? When is it a lifeline, and when does it turn into a double-edged sword? If one day you or a loved one suffers a heart attack, would you know how to act in those crucial minutes without missing the only chance to survive? In the next part, we will open the first door, exploring what happens inside the heart during a heart attack and why aspirin can make such a difference in those first few minutes. 1. Understanding a heart attack. Your heart is a miraculous pump. Day after day, it beats tirelessly, sending oxygen-rich blood and nutrients to every corner of your body. Thanks to your heart, you can stroll with your grandchildren, chat with loved ones, and savor every moment of your golden years. But did you know, just one tiny blood clot can cause that pump to seize up within minutes? And when that happens, we call it a heart attack. A heart attack does not send an early warning from afar. It often arrives suddenly, without notice. Many people in their 60s or even 70s still believe they are healthy because they can walk, garden, or play with their grandkids. Yet the harsh truth is, within their bodies, arteries may have been silently building up plaques for years. Then, one day, that plaque ruptures. Platelets rush in and clog the artery that feeds the heart. Oxygen is cut off, and heart muscle cells begin to die. Imagine a busy highway suddenly blocked by a massive accident. Cars pile up, traffic halts. That's what happens in your heart. It cries out for help, but no one can hear it. The frightening truth is that many people do not even realize they are having a heart attack. They think it's just heartburn, fatigue, or maybe dinner was too heavy. Mr. Robert, age 66, once sat in the kitchen preparing an evening meal. He felt a mild chest tightness, nausea, and a cold sweat forming on his skin. He told his wife, "It's probably just because lunch was too greasy." But only minutes later he collapsed to the floor. By the time the ambulance arrived, his heart had already stopped beating. Does this sound familiar? How many times have we ignored the small signals from our body, only to realize when it was already too late? Research from the Mayo Clinic shows that, especially in older adults, heart attack symptoms are often vague. It may only be upper back pain, unusual fatigue, or slight shortness of breath. In women, the signs are even more different, often not the crushing chest pain we tend to imagine. This is why understanding the mechanism and recognizing symptoms in time is truly a matter of life and death. Think about it. If within just 5 to 10 minutes a portion of your heart has already died, what are you waiting for? If that moment happened to you or a loved one, would you know exactly what to do right away? And this is where aspirin comes in. A small pill, costing only a few dollars, yet capable of becoming the bridge between life and death. But how does aspirin actually work during a heart attack? Why can chewing one pill at that exact moment buy your heart more time until emergency help arrives? And more importantly, why can aspirin both save lives and pose danger if used incorrectly? Let's move on to the next part, where we will uncover the secret inside that tiny pill, the remarkable mechanism that allows aspirin to keep your heart beating for those most precious extra minutes of life. 2. The role of aspirin. If you ask most people over 60, what does aspirin do in the body? Many will answer, it thins the blood. But that is a misconception. Aspirin does not thin the blood the way people think. What it really does, and what is far more important, is prevent platelets in the blood from sticking together to form clots. Imagine your bloodstream like traffic flowing on a highway. Platelets are like small cars driving side by side. Normally, they cause no harm. But if there is a crack in a blood vessel, platelets rush in and begin to stick together, like multiple cars colliding in a pileup, blocking the road. Once that road is blocked, oxygen can no longer reach the heart, and within minutes, heart muscle cells begin to die. At that moment, aspirin acts like a traffic officer arriving just in time, signaling the cars to stop piling up and keeping the road open, at least long enough until the rescue team, meaning the doctors, can step in.
This is not just a metaphor. It is proven by science. In a landmark study known as the ISIS-2 trial, conducted on more than 17,000 heart attack patients, researchers found that aspirin alone, when given right after a heart attack began, reduced the risk of death within 5 weeks by 23% compared to not taking it. That number is not small. It means that for every 4 people saved with aspirin, 1 person escaped death solely because of that pill. And it doesn't stop with the past. A new analysis published in the Journal of the American Heart Association in 2024 estimated that if people over 40 in the United States knew how to take aspirin within 4 hours after experiencing severe chest pain, more than 13,000 deaths could be prevented every year. Does that leave you stunned? A common drug, costing only a few dollars, could change the fate of tens of thousands of lives each year, simply by being chewed at the right moment. So why don't we see aspirin being advertised everywhere as a miracle pill? Perhaps because aspirin is too cheap, no longer of great commercial value, and no company wants to spend millions of dollars to promote it. But that does not lessen the human lives it can save. In the world of medicine, sometimes the simplest things end up saving the most people. However, and this is something you must pay close attention to, aspirin is not always safe. It is a double-edged sword. If taken at the right time, it can save your life. But if taken the wrong way, especially daily without medical supervision, it can cause stomach bleeding, internal hemorrhage, and put you in a situation just as dangerous as a heart attack. Do you see the paradox here? On one hand, aspirin is praised as a lifesaver, yet on the other, it can also become a silent killer if abused. So in the end, when should aspirin be taken and when should it absolutely not be used? In the next part, we will go straight to the heart of the matter, the official guidelines from the American Heart Association, when aspirin can save your life and when it can do more harm than good. 3. When to use it and when to absolutely avoid it. This is the very question most people wonder about. If aspirin can save lives during a heart attack, should I start taking it right now, every day, as prevention? The answer, which surprises many, is no. First, let's talk about when aspirin should be used. According to the guidelines of the American Heart Association, if you or someone else has symptoms suggesting a heart attack, such as chest pain, shortness of breath, cold sweats, nausea, or unusual fatigue, the very first step is to call 911 immediately. That is always step number 1. Right after that, if the patient is still conscious, not allergic to aspirin, and has no known contraindications, then you can chew and swallow between 162 and 324 milligrams of aspirin. To put it simply, that's about 2 to 4 baby aspirin tablets of 81 milligrams each. And here's the crucial detail. Chew, don't just swallow whole, because chewing allows aspirin to be absorbed faster, helping block clot formation right from the very first minute. So when should aspirin not be used? There are 3 extremely important situations. First, if you suspect a stroke, Absolutely do not take aspirin because many strokes are due to brain hemorrhage and aspirin would worsen the bleeding. Second, if a doctor has ever instructed you not to take aspirin due to allergy, severe stomach ulcers, or a high bleeding risk, do not take it on your own. Third, and this is the most common misunderstanding, do not take aspirin daily if you have never had a heart attack, never had a stent placed, and have never been specifically prescribed it by your doctor. Did you know that in 2022, the U.S. Preventative Services Task Force, a highly respected medical body in America, issued a clear recommendation? People aged 60 and older should not start daily low-dose aspirin to prevent a first heart attack. The reason is that the risks of GI bleeding and internal hemorrhage outweigh the benefits of prevention. In other words, if you are over 60 and still taking aspirin every day just to be safe without your doctor's approval, you may actually be putting yourself at greater risk rather than protecting yourself. I know, many of us believe that taking aspirin every day is like having insurance for the heart. Perhaps you or someone you love are doing exactly that. But medical truth has changed. What was correct 20 years ago may no longer be correct today. The question is, do you want to continue relying on old habits, or do you want to rely on the latest evidence to truly protect yourself? That's why you must remember 3 golden rules. First, always call 911 before doing anything else. Second, only chew 162/324 milligrams of aspirin when you have symptoms suggesting a heart attack and no contraindications. Third, never take aspirin daily for prevention unless it has been prescribed by your doctor. It may sound simple, but I believe this is the difference between survival and loss. The problem is, many of us hear the theory but cannot picture how it plays out in real life. So, in an actual emergency, how has aspirin really saved lives, and what has happened when people didn't know how to use it? In the next part, I'll share with you true stories about Linda, Robert, and Ken, people who faced life-or-death moments and how just one pill of aspirin changed everything. Do you want to know exactly what saved them and what caused others to lose their only chance? 4. Real stories. Seattle, on a crisp autumn morning, Linda Parker, age 58, was preparing breakfast when she felt a sharp twinge in her left chest. She thought it was just fatigue or eating too late the night before. But her daughter remembered a video she had watched about heart attack warning signs. Without hesitation, she handed her mother an 81 milligram aspirin, told her to chew it immediately, then dialed 911. When the doctors arrived, they confirmed Linda had a partial blockage in her coronary artery. Thanks to that pill, blood flow was maintained just enough that her heart didn't sustain severe damage. The doctor said, if it had been 10 minutes later, the outcome would have been completely different. Don't you feel as if this coincidence was nothing short of a life-saving gift? In Texas, Ken, age 64, was tending his garden when he suddenly felt chest pressure, as if a heavy weight was pressing down. He remembered a health seminar he once attended, immediately chewed 2 baby aspirin tablets, and called for help. When he was admitted to the hospital, doctors confirmed he had suffered a heart attack. Ken said, "They told me chewing those 2 pills bought me time. That's probably the only reason I'm still here today." Can you imagine the depth of gratitude he felt, knowing he still had the chance to hug his wife and grandchildren? But not everyone is so fortunate. Robert, age 66, thought his chest discomfort was just indigestion. He had no aspirin on hand, and by the time the ambulance arrived, his heart had already stopped. Have you ever thought that a single pill in your drawer could make the difference between a home still filled with laughter and one drowned in tears? So if this happened to you or your loved one, what would you do? How would you be ready so that panic wouldn't steal away your golden window of survival? In the next part, I will walk you through each step clearly, from calling emergency services to chewing aspirin to preparing a ready heart emergency kit right in your home. 5. Step-by-step guidance and preparation.
Imagine you are sitting with your spouse or your parents, and suddenly they clutch their chest, sweat pouring down, their breathing rapid. In that moment, what would you do? This is the golden protocol that every family with someone over 60 must know. Step 1. Call 911 immediately. Do not hesitate. Do not search Google. Do not wait a few minutes to see if it passes. Every passing minute means millions of heart cells are dying. Step 2. Sit the patient down and keep them calm. Many people panic and let the patient lie flat or pace around. But in fact, sitting comfortably with back support helps reduce the strain on the heart.
Step 3. Chew and swallow 162 to 324 milligrams of aspirin, that is 2 to 4 baby aspirin tablets of 81 milligrams each, if the person is not allergic and has never been told by a doctor to stop taking aspirin. Why chew? Because studies showed that when chewed, aspirin begins blocking platelets in just about 5 minutes, whereas swallowing whole can take over 12 minutes. And for the heart, every single minute is life. Step 4. Monitor breathing. If the patient stops breathing, know how to call for CPR instructions. Just one person in the household with basic CPR skills can double survival chances. And just as important, keep aspirin ready at home. Place a few strips of 81 milligrams aspirin in the medicine cabinet, in the kitchen, the bedroom, even in your handbag. You don't need to take it daily, but when the critical moment comes, that tiny pill must be within reach. Do you see how every step is simple, things anyone can do? Yet why do so many people still misunderstand and misuse aspirin daily, putting themselves at risk instead of protecting their heart? In the next section, we will break down the most common misconceptions about aspirin, the very mistakes that cause many people over 60 to unknowingly harm themselves instead of safeguarding their lives. 6. Clearing up common misconceptions. One of the most dangerous problems is not the lack of medicine, but using medicine the wrong way. With aspirin, there are 3 common misconceptions that many people, especially seniors, still believe. The first misconception: take aspirin every day to prevent the first heart attack. This was advice given many years ago, but medical science has since changed. In 2022, the U.S. Preventative Services Task Force officially recommended that adults 60 and older should not start daily aspirin if they have never had a heart attack or stent placement. Why? Because the risk of stomach bleeding and brain hemorrhage outweighs the benefits of prevention. So, if you or someone you love are taking aspirin just to be safe without a doctor's prescription, stop and ask your doctor again. The second misconception: aspirin thins the blood. In reality, it does not make blood thinner. What it does is prevent platelets from sticking together, like a traffic officer preventing cars from crashing, not like widening the road. When you understand the true mechanism, you'll have less fear and also no longer overestimate aspirin as a cure-all. The third misconception: it's fine to swallow aspirin whole, no need to chew it. This mistake could cost a life. Research has proven that when chewed, aspirin begins working in about 5 minutes, while swallowing whole takes over 12 minutes. During a heart attack, every single minute is precious. Would you dare let your heart wait an extra 7 minutes just because a pill wasn't chewed? Aspirin is a lifesaver, but only when used at the right time, in the right way, for the right person. And above all, aspirin can never replace a healthy lifestyle or regular medical checkups. So the final question for you is this: what will you prepare starting today so that in a life or death moment, you and your family will not be overwhelmed by panic? In conclusion, we will return to the image of the golden 5 minutes from the beginning to understand why simple preparation today can bring you many years of peace tomorrow. We have walked together through a journey,
From the moment the heart stops receiving blood because of a tiny clot, to how one aspirin pill can buy enough time until emergency care arrives. Do you remember at the start I said that during a heart attack, you only have about 5 golden minutes to act? Now you know that in those 5 minutes, the most important thing is not panic, not trying to drive yourself to the hospital, but to call 911 immediately, and if no allergy exists, chew 162 to 324 milligrams of aspirin. A small pill, costing just a few dollars, can become the lifeline that keeps you alive. But as you've seen, aspirin is not a health insurance pill to take recklessly every day. It cannot replace a strong heart, and it cannot make up for years of inactivity or skipping regular checkups. What aspirin truly does is simple, yet priceless. It buys time. Time for the ambulance to arrive, time for doctors to save your heart, time for you to have one more day with your children and grandchildren. So starting today, keep a few bottles of baby aspirin 81 milligrams in the most accessible spots in your home. Talk with your spouse, children, and family members about how to respond when heart attack symptoms appear. Remember that calmness and the right knowledge at the right moment can save a life. And if this video has been helpful, don't keep it to yourself. Share it with your loved ones, because one timely reminder could save a father, a mother, or a friend in your community. Have you ever taken aspirin daily without being sure you actually needed it? Have you ever faced a moment when a heart stopped beating in your family? Leave a comment, because your story may help someone else be better prepared. And don't leave just yet. The next video will reveal the silent signs of a heart attack in women that more than 90% overlook. Knowing this could save your wife, your mother, or your sister.